49-year-old Japanese seeks double eyelid surgery to get large, open, attractive eyes. What method is best to fulfill my wish? I'm a 49-year-old Japanese woman considering getting double eyelid surgery this year to achieve my dream look. I've been using eyelid glue to get bigger eyes, but it looks unnatural as I can't close my eyes properly. My eyes are droopy and saggy. What I want is large, round, open, attractive eyes so I don't have to open my eyes as they get tired. I want my inner eyelid cut so my eyes will be bigger. Also, I want to know if I should get this surgery in Japan or US. I prefer the US.
Thank you for your question. You state in your question you're a 49-year-old Japanese woman and you submit two photos, and one with your eyebrows elevated, and you state in your question that you want to have a very particular look for your eyes, that you have been using a glue to try to create the effect, but it's not really that sustainable because of some difficulties with opening and closing your eyes. And you're asking about what type of procedure, as well as whether to do it in the US or to go to Japan. Well, I can certainly give you my perspective. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and Asian eyelid surgery is an area of focus in my practice. And certainly I can give you my opinion as to also the choice of traveling versus staying locally. Now, the important issue here, of course, is predictability. There are more than a few ways to perform Asian eyelid surgery, but they're all dependent on the achievement of a crease or the development of a more defined crease so that the eyes look more open, and what to do depending on the presence of extra skin or extra fat or both, as well as the possible additional presence of ptosis or drooping of the eyelids. There's also options in terms of the concern about whether to have a nasally tapered crease, one that goes towards the epicanthal fold, or a parallel crease. So there are certainly several variations, and a lot of it is dependent on really what can be done. And what I do in my office in the examination is I actually use a simple blunt type of device that we just kind of create the crease to see what it would look like if we were to create a fixation. Whatever the technique, whether it's a non-incisional technique, which is really, it's technically making incisions, but it's making little openings and not a full line where stitches are placed, or an incisional technique where you're actually opening things up and typically removing skin, you're connecting the skin with the muscle. That muscle is the levator muscle, so that when the eyelid folds open, it actually causes the crease to fall in. And it's kind of an effect that you are able to achieve with the glue or the use of tape. And certainly I've borrowed from that page of putting a piece of tape to show a patient what they can potentially look like. Now, it really is a matter of the doctor you choose. You have more than a few options of having doctors within the United States who focus on Asian eyelid surgery. And it's a matter of you being comfortable and confident. Now, as an oculofacial plastic surgeon, a specialist in cosmetic eyelid surgery, I have patients who come from all over the world for eyelid surgery, for elective eyelid surgery, as well as complications of eyelid surgery. So I can share with you my approach. Essentially, when someone comes to me, I want to make sure that they're around for enough time so I can make sure that they don't have an infection or bleeding or any problem like that, and that I could be the one to remove stitches. Usually patients have that preference that the operating surgeon removes the stitches. There are, of course, occasional exceptions. We have patients who are family members who are doctors or who have a doctor at home who will be willing to take out stitches. But at the same time, I can share with you my experience. I've had patients who came to me who found me in New York, who actually live here, but went to Korea to have eyelid surgery. And then when they have questions about the desired result and the outcome and the process, they chose to come to me locally because they weren't having the best time of communicating with the original operating surgeon where they had the surgery. So there are pluses and minuses, and it really matters to what your comfort level is. I think that if you prefer the U.S., you have plenty of options. There are quite a few doctors who focus on Asian eyelid surgery, myself being amongst them. And so I think that I would have confidence in someone who does a lot of Asian eyelid surgery, who really understands it and will be there for you and is accessible. So I think you should meet with doctors and discuss your options. I think you'll find some variability. You have to find the option that works best for you and that you feel the most confident in and move forward. So I hope that was helpful. I wish you the best of luck and thank you for your question.